Welcome to the Monroe County Board of Health's virtual meeting. I'm Celinda K. Leach, and I'm serving as the board chair. I'm going to ask the board to introduce themselves. Mark, you want to start?
Yes, Mark Norrell, and I am a senior lecturer at Indiana University's O'Neill School, and I teach in the healthcare management and policy program there.
George?
George Hageman, retired microbiologist from the biology department at IU, member of the board.
Steve?
Steve Pritchard, retired dentist, board member, and tennis player. Just not very well.
I was going to say good one, I hope. Carol?
Carol Talukian, board member, retired pediatrician.
Bob?
Bob Wren, retired physician, board member, part-time photographer. The loons are back at Paintown.
Okay, and our our administrator, Penny?
Dr. Sharp is also here.
I'm going to get you, Dr. Sharp.
Penny Cottle, Monroe County Administrator, and Ashley says she has joining as well. So we may want to look for her. Yeah.
And we have our health officer, Dr. Sharp.
Yes, Dr. Sharp, and actually Steve is being a little, he's better than he says at tennis.
And Margie Ross?
Hello, I'm Margie Rice. I'm one of the county attorneys.
Okay, and I'm sorry, Penny, is Ashley on? I can't see her.
She texted me that she is. So Michelle, if you can look for Ashley Craner.
I did promote her once. Give me 1 second to double check.
Yeah, she's listed as, I saw her on there, R-E-A Craner. I did.
Okay.
There she is.
Hey, Ashley.
Ashley, you want to introduce yourself?
Sure. Ashley Craner, Vice Chair of the board. Sorry, I'm a little, hi, everybody.
Okay, I'll call our meeting to order. And first thing on our agenda is public comment. Do we have anyone out in the public that would like to make a comment to the Board of Health?
Looks like we have one hand raised from Mike.
Mike? Mike, I think you're muted.
There, can you hear me?
Yes, we can. Go ahead, please.
Hey, wonderful, wonderful. Can you see me? I can't see anyone, but that's no big deal.
Yeah, we can't see you, but we can hear you.
Oh, great, great. I can't see anyone. Hi, you know me. I've been used to go to the board meetings a lot. I just wanted to see if you could do some research. So far, everyone I know that's taken, there's research showing COVID-19 double-blind study hospital vitamin D3 at less than 1 milligram when added to everything else stopped or was successful at 100%. 13% of people passed in the other group. Whatchamacallit, intravenous vitamin C was announced by New York hospitals. It's in the New York Post. South Korea and Shanghai, the most oldest medical center, including by an American Chinese doctor, to be 100% successful. These are all things, I'm only limiting it to things that we can take. And then zinc ionophores, melatonin, beat out COVID-19 hospital double-blind study of upper, end-stage disease, end-stage breathing. It had no deaths, no ventilations. The placebo group had 35% of people passed. And that's a zinc ionophore, melatonin zinc, elderberry zinc, green tea and zinc, and quercetin and zinc. Those are the three categories: zinc ionophores, C and D, which we can take. We don't need a prescription for. If you could do the research on that, those were the things that were called 100% successful. And America's frontline doctors, they just went up and talked to our representatives in the Capitol. They also have a lot of this research put together. So I'd like to hand it off to them for the research they've done. And they've been trying to say, hey, we have some things that are 100% successful in both treating and preventing. And, just hoping it gets out there. And I was hoping we could research that as well.
Thank you, Mike. Thank you for your input, and we'll look into that.
The last thing, I'm sorry, only one more thing. If you could research it yourself, there's a number of studies, and Children's Defense Network just has reference to the studies. But there's a Department of Defense study citing a 36% increase. There's two children's studies, one in 2018, where they tried to replicate what happened, the study that was done in 2013 or published in 2013. And they both found over 3 years, the 2010, 11, 12, 2015, 16, 17, up to a 6 times higher rate of other respiratory infections other than the flu after getting the influenza vaccine for those years 10, 11, 12, 15, 16, 17. But the highest, that 6 times high, that was for people who got it 3 years in a row. People who got it less years in a row had a lower percentage, like in the Department of Defense study, where they only showed 36% increase. Now that's increase in rhinoviruses, coronaviruses. It doesn't mean a 6 times increase in just coronavirus. But there's one more study 1 month ago by a university that found 6.7 times higher viral respiration, but spreading when right after people got the flu shot. So that was just, and I was looking to see, oh, by the way, the one vaccine that's been shown to, and they're doing they've done a study, and now they're doing a multi-country study, is the old BCG tuberculosis vaccine. That vaccine was found so far, and everyone who's gotten it, to significantly reduce both other viral and bacterial infections, and so far to significantly reduce coronavirus infections.
Thank you.
Thank you so much.
Any other people out there, Michelle, for public input? Hearing none, we'll continue. Old business or continuing business, Penny, you want to give us an update?
Sure. We just really met, so I will say that our community testing site is ready to open on Monday. We sent out the press release about that, so we're excited about that. The ramp, I think, is ready to go as well, so hopefully we won't have any issues with that, and so we should be ready to roll on Monday morning. We are encouraging people, if they have internet issues, if they need assistance registering, that initially they use the Optum site. This clinic doesn't have the ability to do walk-ins yet, and we hope that that will come soon, but we need to get things kind of started off, get kinks worked out and all those kinds of things. So if someone doesn't have internet access, we would encourage them to use the Optum site where they can take a walk-in. But please register, complete your registration before you get there, and that will make things go really quickly. They'll be ready to serve you. Our numbers, I think everybody's looking at our numbers. They're not great. This week, we stayed in yellow in that county state metrics map. I was a little surprised, to tell you the truth. So I would anticipate we will be orange next week. I'm not trying to say the sky's falling, but I was surprised that we weren't already there. It's kind of close. So the numbers are going up. We know that people know how to reduce the spread of this infection. We just all need to maintain our mask wearing, our physical distancing of 6 feet, washing our hands, avoiding crowds and not being masked and distance and staying home when we're sick. We do have flu clinic next week, a drive-through flu clinic at City Church from noon to 3. And that will kind of be a test for us as well. We'll test our pod plans and see what changes we need to make for our vaccine clinics this coming year when we do COVID vaccine clinics. So those are my main things. We do have Erin with us today to give you an update from our compliance officers. They went out last weekend, and I think they were out last night, and they've been doing a great job, and I don't believe they've had any real issues. They're there to assist, and I think Erin has an update that he can give you. So I would gladly just turn that over to him.
Hello.
Hi, Erin.
So, as she said, we went out Friday and Saturday night last week. Friday night is our first night, Saturday night being the second night. And obviously, we're working on things. We're trying to get some things figured out as far as timing goes. I know we had originally set the times from 9 p.m. to 3 a.m. That's great for the bars. It's not great for the restaurants with bars in them. We see that their business hours are more of 5, 6 o'clock p.m. to 9, 10 o'clock. So we've worked with Penny this week, and we've kind of changed the hours. So I'll go through some of the numbers here real quick. On Friday of last week, we visited 41 open locations. And we went to 58 closed locations that were closed before we got there. And we had 2 places that we didn't get to before they closed. Some of the things we saw and what we did was we really took the opportunity to explain to people. It was a little unclear what exactly we were going to do. So we took the opportunity to tell them it's more of an education compliance thing, to help them learn what they can do to make things safer and make things better within their establishments. We went over what we were looking for as far as patron mask, when not seated at a table, staff mask while they're around at all times. The social distancing part, making sure tables were 6 feet apart or close to. And also the last one was the bar top service, which there's a lot of questions about that to us as far as how the bar top service was going to change, if it's going to change, and we didn't quite have the answers to that. So we told them to tune into this meeting. But it was good interaction with all the managers and owners that we talked to. They were excited to hear that it was an educational opportunity for us to work with them and help them and be a resource for them. A lot of them like the fact that, hey, now we don't have to be the bad people as owners and say that you have to wear your mask. We can pin it on the fact that we have compliance officers out there that are checking, and they can blame us for it. We'll be the bad people and say, hey, yeah, you got to put your mask on. And we did do some of that with the owners. We saw a lot of the non-mask violations came from pool tables, darts, type areas, because people think that that's a physical activity and it falls under the physical activity realm. But we all know that you can play pool and darts with a mask on without any problems. So that's where we saw a lot of that. We did hand out we probably handed out 25, 30 masks to people waiting in lines at restaurants and places that didn't have masks. So that was a little bit about the weekend. We also went out last night. We changed the hours last night. We made it to 54 open places. There was 39 closed places that we went to, and 8 establishments we didn't get to last night. So what we'll do is we'll actually, we've set up routes within the list that we've gotten from Penny. So we'll run those backwards tonight when we do our checks. And so we'll hit everything that we didn't get to last night, we'll hit first tonight, and then we'll work our way back through. And then we'll flop when it comes to Saturday and do that. We're also going to add checking on the bars a second time. We went to most of the bars one time, but depending on what time you go to the bars and what time you get to the bars, the crowd varies and differs. So if you went to a bar at 9:30, 10 o'clock, it's not as busy like we saw last night because people stayed home to watch the football game and that stuff and then came out afterwards. So the bars picked up the later it got. So we're still working on trying to figure out, timing as far as when bars and establishments are open. Everybody kind of varies now with COVID. You can look on their website and it'll tell you one thing, but you get there and they're closed. So we're working on that too. But if you guys have any questions, I can take those.
Thank you so much. Does anybody have questions for Aaron? That's good news to hear.
I do, actually.
Oh, you do? Okay.
But, well, first, Aaron, we're really happy to have you and the organization on the team in this effort, right? Because we can promulgate all the rules that we want, but if we don't have a way to get that out and get people educated about it, then it's just not going to serve the function that we intend. But when you and your coworkers are out, how are you identified? I mean, how are you? I see it. It looks like you're wearing something that has a logo on it.
So yeah. So we actually worked with Penny and we got you guys' logos. So we have a gray polo shirt, which I can get one of, that's got your logo on the front chest, and it actually has compliance officer across the back, printed across the back.
Fantastic. And
so we kind of decided to do that, and talking with Penny and with Jim and Margie and them, and you can walk into somewhere in a security outfit and probably not get the respect that you need because you're a security company telling them, this is what it is. But we found that with the logo, the health department logo, people were, very receptive to it. So I'll hold it up here and it's got your logo there. And then it says compliance officer across the back.
Fantastic. And do you interact with the patrons at all, or are you exclusively consulting with the owners and proprietors?
So a little of both. Obviously last weekend was the first weekend. So every time we went in somewhere, we asked for a manager, owner, somebody like that. And we talked with them. We probably spent 5 to 10 minutes just with the owners, talking to them, showing them what the expectations were, what we were looking for as far as compliance goes. And the big thing is reassuring them that, we're not there to write tickets. We're not there to find people. The big thing is we're trying to educate them so we keep the numbers down and they keep their establishments open and money in their pockets. But then as it's gone on, we've gotten to the point now we're on the third night where we see a lot of the same owners and managers. So we can basically wave to them, let them know we're there. We do our walkthrough, we check. We've also, Jeremy up at the Video Saloon, we worked with him and he asked us if we would go around with him and just kind of, remind people to put their mask on. He did the reminding. We were there as the bad guys to say, hey, these people want you to wear your mask. Can you wear your mask? And people do comply with it. And it's funny, now we're on the third night. Last night when we were walking through the establishments, people see the compliance officer on their back, and you can see them even sitting at a table with drinks in front of them and not doing anything. They'll put their mask on when we walk through. So it's kind of funny to see how just a little bit of a reminder to people helps them out.
Aaron, I'd like to ask a question. How many people do you have on your staff that are doing this for our county, please?
So right now we have 5 people trained. Myself, one of the other supervisors, Steve Hines. We've been out both nights, mainly because I wanted to see it before I put my people in the situation. What are they dealing with? Are we dealing with angry people? Are we dealing with people that are going to be upset, confrontational? And that's not the case at all. We really haven't seen a whole lot of confrontational people. We've seen people that say, you know, I don't want to wear it. I shouldn't have to wear it, but they do put it on. So we've got 5 people that are currently trained to do it. And that's probably where we'll stay till we see how long it goes and how many people we're going to need to sustain, you know, the job that we're doing.
If someone's resisting, do the owner ask them to leave? Is that your avenue for correction?
Yeah, absolutely. And we've talked with Penny, and we're not gonna. It's not gonna get into a confrontational match with us. That's not something that we're not gonna argue back and forth with them. You know, we'll tell the bar owner that, hey, you know, they need to have a mask on. And I think the bar owners and the restaurant owners, they know that they're the ones that are you know, liable for if you guys decide to take action against them. So it's really up to them. We'll stand there and be the bad guy and say, hey, you got to put it on, you got to do this, you got to do that. But, you know, when it comes down to the end, it's really up to the restaurants and bars to say, you know, we'll provide you service, but you need to follow the rules. And if you don't, then we're not going to serve you and you can leave the establishment.
Good for you. Good for you.
Yeah, I think you have the right attitude. I mean, the whole thing is well done, I think.
And that's the thing, you know, we've worked really hard to explain to the restaurant owners and the bar owners that it's really about education and compliance. It's not about the county. The county's not out to try to make money off fines and tickets and all that stuff. It's that you guys want to do what you can and do your part to keep their establishments open in the long run.
Are there any fines levied for these violations? Margie talked about that earlier. There is a possibility.
There is a possibility. We have been issued some ticket books, but we haven't got to the point where we've even needed to find out what the fines were, and that's something we'll work with Penny on if it comes to that. But right now we're seeing great compliance out of everybody with just reminders and just talking to them.
Any other questions for Aaron? Thank you so much, Aaron. We really appreciate you being here and getting to meet you, and also the work you're doing.
No problem. No problem. Like I say, it's a great opportunity for us to help you guys, you know, accomplish your mission, and anything we can do, just let us know, and we'll be happy to work with Penny.
Right. Thanks, Aaron. And they are dropping off. We had the files are kind of big, so we're working through how we get those reports, but we did get those today, but so we'll be able to share those with you going forward too.
Anything else, Penny, that you want to report?
I think the only...
Oh, Penny, you're just muted. Became muted.
Sorry about that. I think the only other thing I have really kind of leads us to the next piece, which is the discussion around the regulations. As you know, that I mentioned the numbers are going up, and they have been. Governor Holcomb announced on Wednesday change to the executive orders. By noon, they still had not been posted. So I don't have the exact order to go line by line. We only kind of know what's been reported out. They are using the color-coded metrics map. If a county is in orange, and I think there were only 5 counties this week that were in yellow. Everybody else was orange or red. So if you're in orange, then the gathering size, regardless, commercial, non-commercial, private, doesn't matter. One gathering, social gathering unit, and that's 50. If you're in the red, it's 25. There's some changes to sporting event the size limits for sporting events, and some other things that will come, but those are probably the big things that were put in place. The other good news, which we have not seen, again, anything specific about, but he noted that they had $20 million they were going to put out to local health departments to help with compliance, with reporting, with all these different added things, going through the plans. If people want an exemption, so now, you know, this, not only do we have that exemption portion, but the state, if you want something over 50 and 50 is the limit, then that exemption comes to us. So those are the kinds of things that we want to talk about tonight and in the coming weeks as well.
Penny, I just want to ask you, have we had a lot of people apply for exemptions?
We regular flow of exemption requests. They're not huge, but they can take a fair amount of work. A lot of them are weddings, wedding receptions, things like that. We've had a few kind of public gatherings or events, but for the most part, I would say most of them tend to be kind of wedding kinds, receptions, those kinds of things. We have a template that they have to fill out so that it's really clear what they need to have. And I will give a shout out to one wedding, and they really went, I don't want to say above and beyond, because in this times, I'm not sure we can go too far above and beyond, but they really thought everything through and asked questions. We can do this if you want us to do that. So they, you know, we required that they have a way to kind of keep some track of who was in attendance. With a wedding, that's not difficult. You have your invitation list, you know who was there. Because if we have cases pop up at that event, we want to be assured that we can do contact tracing for the other people that were there, those kinds of things. So spacing, how are they spacing? How many people do they want? What's the purpose? All of those kinds of things. So we don't get a lot of them, but we get, you know, a handful every week.
Okay.
And it can take a lot of back and forth in terms of, okay, you haven't addressed this, how are you going to do that? And then, so there can be different conversations, but we go through them, staff go through them, and then they present them to Dr. Sharp and me, and we kind of, some of them are pretty easy, standard, but there are a few that we have to kind of talk out.
Anybody have questions for Penny?
I just have one comment about the new testing facility. I did take advantage of the 2-hour little open house they had on Tuesday and went down and talked to the staff. And there were two issues. Well, one you sort of touched on, Penny, is that the registration, this particular registration allows you to make an appointment before you actually complete your registration. And so people are arriving with incomplete registrations, and then they have to go over with their cell phone into this designated standing area. So which is not huge. So hopefully you're not going to have too many people down there at one time that aren't registered, because that could even be a problem. So, and then the other thing was, I was definitely disappointed to hear that at least the stated return time for the results is still 3 to 5 days. And I was hoping for a lot less than that, but I understand that's what it is. And I'm hoping that it's going to be much like the Optum testing facility, where they tell you it's going to be 3 or 4 days, when really it's like 24 to 36 hours.
Not anymore, Steve. It's now 5 to 6 days.
Is that right? Okay. Well, when I was going down there, it was, but you know, that, I mean, we all know what the problem is. You know, you could be tested 5 days ago and not have been positive, but by the time you get the results, you are. So.
Well, and yeah, thank you for that. The thing that I would say about that, obviously, depending on how many tests are being done at any one time, when we see these surges, we know that it means that there's a longer time to get results, because there's just more tests being done and they all take some time. The tests will go to a variety of labs, so they all won't be inundating one lab. So hopefully that will make the turnaround. I know the state has indicated they still anticipate them being back within that 72 hours. But it's going to vary depending on just how busy all the labs are. And again, with the registration, there'll be signage outside too that tells people, if you haven't finished your registration, please do that from your car. Do it before you come in. But yeah, we're trying to plan for every scenario. So we have a small space that we can put somebody in if they need to get out of the line and not hold the line up. But we encourage and want everybody to complete that registration fully before they step in the door.
I have a question concerning the kind of state of affairs. Is there any discussion about us ever getting rapid testing? Or are we just going to be here at this kind of 72 hour?
Well, depending on where you are, for instance, the university has some rapid testing. The rapid testing does require CLIA waivers. So we don't have one for this clinic. So before we could even think about that, we would have to go through that process. So there are some places that you can get rapid testing. Most of the rapid testing is ideally for people who are symptomatic within the first 7 days. And then if the rapid test is negative, you would do a PCR test to make sure that they are that it wasn't a false positive. Now, there are times that they use the rapid tests for more of a kind of surveillance type of piece. The other thing that I would say, if people are symptomatic or they really think they've been exposed, they're a close contact and they're testing, they need to act as though they're infected and self-quarantine until they get those results back.
Mark, you were going to ask a question. Do you still have one?
Let's see. Yeah, I had a clarification question from something, Penny, that you said, and maybe I heard this wrong, but you were talking about Marion County and Indianapolis, and I thought I heard you say that there was a gathering limit of 50 in effect, but what I saw in the publication that you shared with us is that effective Sunday night, it's going to be 25.
I may have misspoken. Yes, the governor's executive order has a limit of 50 for orange and 25 for red. And Marion County, kind of like we have, they have all along set different guidelines.
Right. So they're looking at their statistics in Marion County and their trajectory, and they are anticipating that, in fact, it's going to get worse. Is that maybe a conclusion that we can draw?
Well, at the look right now, things are, they could be turned around, but keep in mind that even if we want everybody to start doing what we need to do right now, right? If you haven't been, please start. But it's going to take 2 or 3 weeks at least before we even get through that, and that really we start seeing the impact of those improved behaviors, because there could be people out there incubating right now. So they are seeing a huge increase in cases, certainly.
And I'm assuming that all of you on the board are watching the dashboard from the state health department. And of course, Monroe County on Wednesday had 130 positive cases, which nearly blows away the earlier days, except for the period at the beginning of the school year where there was the arrival testing. So we're in a zone that we really haven't seen before as far as percentage positive and number of cases. And, we can anticipate where this is headed. So and maybe the other part of this is for our consideration is, would it make sense for us to put in sort of some automatic triggers based upon how Marion County is doing it with their color coding? Because the color coding comes from the state health department. Is that correct?
It is, and that was one of the thing in terms of sort of the discussion points that we tried to make, that we certainly could look at that, even with bars and restaurants, for example. But with gathering limits, we certainly can look at that and follow that. So if we go to orange, this is what we're doing differently. And then if you want to do something different while we're in yellow, you could also do that. There could be times, just like we could explain before with the arrival testing, and after that, we kind of knew that those IU tests, we were getting the positives, we weren't getting the negatives. So we were, if they'd had the colors then, we were in kind of that, more of that orange. But there could be times where we could explain that and deal with it. But certainly, in general, if you use that system of matching some regulations to the colors, people know what to expect if that change happens.
And they know why it happened too.
Right.
I have a question about, what to do as things, assuming things will be getting worse, is some localities, I don't know if any in Dan have like shut the bars earlier, like 10 o'clock or 11 o'clock to try to cut down, as my mama used to say, nothing good happens after midnight. Yeah. And is it something we've actually considered at some point? Because I know that puts it's kind of not good for the bars as they sell a lot of drinks at that time of day. But on the other hand, you get stupider as it gets later. And
right. Yes, that was in our list. Hopefully everybody got the kind of the draft with some discussion points. And that was one of the things when we did the survey, that was one of the questions we asked. How do you feel about closing early? Certainly it could hurt the revenue, absolutely. But as Aaron and their team stated too, a lot of the bars even are closing earlier than they ordinarily would have. So certainly looking at that, if we're orange or red for early closures would make sense.
I would certainly be in favor of that, just because it just makes sense.
Well, it sounds like we're going to number 2, which is the health order and our regulation discussion. Penny, do you and Margie want to take that? And I don't know if we have a document to put on the screen or not.
We do.
Okay.
Yeah, Michelle Dayton has it. She can put that up. And Penny, I'll let you go through it if you'd like, and then I can comment as needed.
Sure, we can.
Yeah, if you want to. And I think, Michelle, you may want to scroll down. Scroll down to where you find some edits. I think it might be paragraph 7 or 8.
I think it's 7.
Yep, there you go.
Yeah.
Yeah, so this first this paragraph here, I thought was really good. That was kind of in my notes, in that it explains the difference. There's a lot of confusion sometimes because the city of Bloomington put in an executive order on gathering size limits for personal gatherings of 15, and we have 50. And then we have non-commercial or commercial, we have commercial gathering places. So a venue, right? The convention center, someplace like that might host events, and they could have 100 inside or 150 outside. And this was the one thing that I was referencing. If we go to orange or red, that commercial designation that we added would not be in effect. But I liked this that's yellow because it really explained that the county has a regulation piece and the city has a regulation piece that are slightly different. So if you want to look at gathering limits, I will say one of the things this time, gatherings, the executive order, he referenced all gatherings, all types. And one of the things that we've seen change over the months has been the definition of a gathering. But that may be something that we want to look at, but I don't think we would have to necessarily change that for us right now. We know that we can't be less strict, so anything that we do keep that becomes less strict is a moot point until something changes with the executive order.
I'd like to ask our health officer, Dr. Sharp, how he feels about the gathering order that we have.
Yeah, I think anytime we go from, like, for instance, yellow to orange, we're going to have to make a cutback in the percentage of people in any establishment, and probably 50%, but and reviewed weekly. So yeah, there definitely needs to be a decrease in the number of people that can attend these events. Some of them, especially the commercial ones, they are so tuned into this that we can, I mean, they have their plan, they know how to do it, they've done it several times, and I worry less about those than I worry about private events, particularly with Thanksgiving coming. Oh my gosh. People coming from all over, getting together, no masks, and sitting at a table for a couple hours. That's really a problem, and there's no way to fix it other than just education. And there's certain people that are just going to ignore whatever we say. But I definitely think when we graduate from yellow to orange, which is likely to happen next week, that we will be cutting down the meeting sizes.
Thank you. Well, I like the idea of going to the colors and looking at it weekly. It keeps you more up to date with what's going on, and I think it can help people understand why something is changing. How does the rest of the board feel about it?
I think the color scheme is a great idea. I really do. I think it's easy to grasp.
Yeah, I like it too. Do we need to put something, this is from Margie, do we need to put something in the health in this document to say that the health officer could just change it according to, or do we have to be very specific?
You know, we can do it either way. I might like to say that in this document that we are going to review weekly and go with the color scheme, and that will be adjusted by the health officer, just to make sure that we reference in it. And then Penny and Dr. Sharp can define what those are, unless, again, you guys want to make those definitions today.
I like Margie's formulation.
What was that, George?
I said I like Margie's formulation, what you just said.
Yeah, and I certainly trust Penny and Tom's ability to make those decisions.
Well, actually, that's a fundamental concept in public health, is that we have the health officer there for, these kind of things that have to be done on a timely basis, and they have that authority already. It's not as if maybe I'm saying this wrong, but I think that authority exists currently. It's just that we're underscoring it here.
Yeah, no, I think that's right. I mean, I think that the Board of Health has certain powers, the health officer has overlapping powers, and the fact that the board will formally recognize and delegate some authority to the extent that they would even need to Dr. Sharp, so that he can be nimble and flexible. Public health makes sense. So we can write that in there and recognize that we are going to adjust, and the health board wants Dr. Sharp to adjust based on sort of the color scheme and taking that guidance from the state of Indiana.
I think it's important that we show that the health board supports what the health officer is doing.
Mm-hmm.
Right.
Now, I think, Michelle, if you want to scroll down there, maybe a little bit more detail, a little bit farther down.
I have a question. Can we go back to number 4 just for a second? I think 4 is where they talk about physical activity, because one of the things that Aaron said Was that what, that seemed, people didn't seem to be clear as to when they need to wear a mask? Is it number 4 that has the stuff about activity?
I
Maybe
think
it's not 4.
2.
It's the one that says when you should wear a mask. Maybe it's up further.
yeah, anybody who's getting their heart raised when they're playing darts or
There it
pool,
is, right there. Okay, yeah. Okay.
yeah, if they think that that's aerobic activity and they're raising their heart rate by playing darts or pool, they need some help. in
Yeah,
my
really.
opinion.
So my question is that clear enough for Aaron's purposes, or is it, I mean, we need to make that more clear.
Are you talking about K? Individuals who are engaged in that outdoor physical exercise, including running, jogging, walking, bicycling, or swimming?
No,
Is it
the
or?
indoor.
Okay, I. Indoors who engage in a form of indoor exercise that is incompatible. I think that's clear. It says, I mean, anybody who thinks that, you know, again, wearing a mask is incompatible with, I mean, we can be more specific for those people who want to just argue, but I think that's clear.
I'm just saying that in response to what Aaron said about, you know.
Yeah,
the pool
I
and
get
the-
it. We could say individuals who are engaged in a form of indoor, you know, aerobic exercise that is incompatible with wearing a face covering, including swimming. You know, this is not intended to apply.
Yeah, it's just adding that word probably makes it more clear and makes it clear that darts and pool don't count.
Yeah, and we really haven't seen any like pushback on it once we tell them to put mask on. But you know, it's still one of those things, kind of like when it first came out, and they said that if you had breathing problems or something like that, everybody with asthma didn't wear. You know, so it's just one of those things.
I get it.
I will say that one of the things that I wanted to mention was, and I don't know how you want to handle it or how it's handled, but the restaurants that have small waiting areas have trouble social distancing. And I don't know how that's should be handled or what. You know, it's getting to the point where it's cold for people to wait outside. I don't know if they can have them wait in cars or what, but that's going to be an issue as winter comes and restaurants get busy.
You know, when I go to the hairdresser, I wait in my car till she says I can come in. I mean, there's nobody in the waiting room.
Most of them have those little handheld things that buzz and tell you it's your turn to go in, and they could certainly sit in their car with it.
Yeah, but they don't have that in Bloomington. That's weird, okay? Because I was thinking the same thing. Up in India, I just don't know of any restaurants. It's not a practice down here.
Just that other than Panera, I can't think of one either.
Yeah, one option that we had talked about at some point, Penny, I know when we were having a conversation with the restaurant, was having, and it might have been actually the Bluebird, and they were talking about concerts, but having a reservation system where there's a hostess that you have a reservation and they'll call you when your table's available might be a way to go with that. I appreciate you bringing that up.
I think Open Table allows that to happen.
Yeah.
You know, the app for Open Table.
Mm-hmm.
That one's readily available to people, and I don't think it comes with a huge cost with it.
Yeah, we can certainly, and it's Nicole's on this call. I don't know if that's something that has come up in conversation that you've had, Nicole, but how do you think that Open Table app or a reservation system would work?
I think that facilities have to pay to be a part of Open Table, so some of them may be hesitant to actually join that platform. But I think that reservations have been talked about for a lot of the establishments, but even with reservations, there are times where the tables aren't turned over as fast as they could be. And that in that point would be, you know, wait in your car and we'll call you. I don't know very many people in this day and age that don't have a cell phone. So it may be that we say there's no waiting indoors, wait in your car and we'll call you when your table's ready. I don't think that that's an unreasonable request, especially if it's an option of keeping doors open or allowing them to make reservations and wait in their cars. I think that the reservations it won't be hesitant. They won't be hesitant. There we go. They won't be hesitant to make that as a requirement or take that as a requirement.
Well, I think it would be helpful if the mayor or if the city can come up with some additional parking solutions for the businesses and meter waiting for reservations, waiting for pickups, all of those variety of things that currently it costs for you to sit in your car.
I did get a email from the Office of Economic and Sustainable Development this week. They sent a survey out to local businesses, and one of their biggest concerns was parking and the cost of parking and people not wanting to pay for parking. And then with Kirkwood closed, there's also that hurdle that businesses are struggling with trying to find parking throughout that area. So I agree. I think that that's a concern on their end. I don't know how we are able to help with that, but I do know that that has been brought up on a couple different occasions, especially with if they have to pay for parking and walk from a million miles away to pay for the parking and then come up. They're not going to want to wait in their cars, go inside, then go back out to their car that's 2 miles away and then come back. They're just, I don't know how to fix that though.
The other thing that, I was just going to say, the other thing that I would say is that some of this could be addressed once the executive order comes out. I know in terms of even masking, it seems like there may be fewer exemptions for masks, those kinds of things. So some of that we can address it, but it may also be addressed once we see those final orders.
Penny, it must have come up right as you went downstairs. I do see it, and he is very much more specific with when those masks have to be on, almost to the point where unless you have a bite of food in your mouth or you're taking a drink, that mask should be on. So it does get more specific. And even with gathering sizes and things like that, he's much more specific with the order this time around. Event directives are more specific, and even social gathering definition is actually defined to a point where I think that people might actually understand what it means. And it goes into social gathering is private or commercial. So it combines the two, which is actually probably going to be very helpful.
Mm-hmm.
Margie, when we're talking about masks, one of the things I think we should make sure is covered is people should keep their mask on when they're ordering to protect the server.
I agree. We can make sure that that's very explicit, that unless you are actively eating or drinking, you should have your mask on. And that includes when you're ordering, keep your mask on. And we can specifically mention in there that the intent is to protect wait staff and personnel. I think that sometimes when people understand why there's a regulation, they're more likely to comply. But it's not just some arbitrary, we want to make you uncomfortable in your seat rule. Okay. So Michelle, if you don't mind scrolling down, I thought a little bit later in this order, we had specific language that I know that Nicole had worked on. She had some good edits related to restaurants. I don't want to go over.
Number 9.
Yeah, bingo. We hit the jackpot.
I think on below that, hey, Michelle, can you go down just a little lower for a minute? Is there some other notes? On down, like at the very end. Yes, yes, on down. So Nicole and I met and talked about some of this. So, so you can, hopefully page 6. Is there a page 6? Yes. So we went through and kind of talked about how some of those things would work. So we might want to just look at that. That will help us. Because we talked about how some of them, if we were in blue or red, yellow or orange, what those might look like.
That's down below further, right?
Mm-hmm.
It's at the end. It's on page 6. And I think it says, notes, pros and cons, general comments.
Right.
Page 5.
So one of the things that we talked about, and again, definitions have changed over time. And Nicole, if you've got that order up, so at various times, like in the feedback, there was entertainment, music venues, although that's not included or wasn't included in the executive order before. It was bars, restaurants, and nightclubs. And it specifically says everybody has to be seated. So because we had been talking about, could people stand for, could they be allowed to stand masked, distanced, like where the dance floor may have been. But by the executive order, that would not be allowed because it specifically says you can't be standing.
It definitely says, so it's restaurants, bars, taverns, nightclubs, and other establishments that provide in-person food and drink service. It says that while all patrons must remain seated while consuming food and or a drink, or when otherwise remaining on the premises. So anytime they're on site, I don't think that that's changed from the last order, but anytime they're on site that they would have to be seated. And then it says capacity limits are no longer based on percentages of overall occupancy, but the seating must be arranged and maintained so that individuals, households, or parties are spaced 6 feet apart. So that is a little bit, I think, more specific than just 6 feet apart. I think that is person to person, as opposed to just having the tables.
Right, that was in the last one. Yeah, that's not a change. That was in the most recent. Yeah, it is people to people. Yeah.
So we may need to figure out a way to maybe better clarify that for the spacing.
Yeah.
Yeah. And I would think that based on tonight's meeting, what we might want to think about is making this effective. And Penny, Nicole, you, and board members, let me know what you think. But I think it would probably be good to make these effective early next week. Are you thinking that, Penny? Like Monday at 5, or give us a little time to work with this language on Monday and get it exactly right?
Yes, I think we do need some time. We need time to look at it, and we need time in terms of some things that are easy, I think can really go into effect right away once we get it done. There are some things, if we're requiring a plexiglass or barrier, we just need to make sure that we're saying you can do this, and once you get that, you can do this, for example. We just want businesses to have a little bit of time to plan for anything that they need to do. Anytime I think that we can give them a heads up, the better.
The other thing that's in this order that I didn't think about and probably should have was the self-service beverage and food stations. Right now, the state is saying that they're permitted but not recommended. I personally would suggest that we maybe say no buffets at this point, just because as numbers increase and people are walking up to the buffet lines and things like that, I think that probably needs to be in here and clarified. And I didn't think about it until just now.
And it does stop them once they're in orange and red, I think. I read that somewhere.
Yes,
I think true. Monroe County, or not Monroe.
Maybe it was Marion County.
Did that. Marion County did that.
So, so that could be something that we could put in there, even if it's orange, or if you want to do it now as well, for yellow, but.
May I ask, Nicole, do you have a preference? If it were yellow, would you want to say no buffet?
I think that if they need to or feel like, because there are some places, if they are able to have a staff member do like a cafeteria style buffet, I think that would be okay in like a yellow type scenario. But after that, I would say probably no. I mean, Penny, are you okay with that?
Yeah, I think that makes sense. We could think in terms of blue, you could have it open. We would still recommend staff serve it. In yellow, it has to be served by staff. We would still recommend not, and then if it's orange, the buffet goes away. Yeah. That would make sense to me.
Okay. I don't know why I didn't think about that sooner.
Well, it was one that got, that buffet thing kind of got thrown in that last one and kind of surprised all of us when we found it, so. So the last time we talked a little bit about the lines for instance, for bar service, that if a bar could maintain a small line with people masked 6 feet apart, then they could purchase the drink and go back to their seat. And we had a section about that. Michelle, can you go down a little? Yeah, I don't know that the wording is right here. So in relation to bar top service, that we could think perhaps in terms of everybody, they could have drink service at the bar, order and pickup. If patrons and staff are masked, there's 6 feet of distance between them, and those markings are on the floor or otherwise indicated. A protective barrier is used somehow so that even, just like when you go to Target, somewhere like that, they've got a barrier. The line's maintained to ensure it doesn't encroach on any service areas, tables, or other patrons.
And I think the end of the line should be marked end of the line.
Yeah.
The mark on the floor should say end of the line.
Yeah.
So that people don't just continue the line.
We actually had that discussion, yeah.
Yeah, it says, I think we said we wanted to make sure that it was a clear start of the line and a clear end of the line to make sure that all of that was in place so that people can't be like, well, I'm in line and I'm 6 feet away, but
right.
No, I think that that's reasonable. But I also think making sure that it's a designated area at that bar top for that over the bar service, that it's not the entire bar. It should definitely be a specific area that is just for that. We don't want people scattered all up and down the bar. That's kind of what we're trying to prevent in the first place. But if we have a designated space and say, hey, this is where you can get this if you have these measures in place, I think that's a reasonable accommodation for them.
I agree.
Mm-hmm. So then I don't know if there's other discussion that was just kind of after the meeting last time that people seemed to think that made some sense. So then when we went to talk about that bar top service and seating at the counter, and again, I'm not sure what's in the governor's current order, but if you scroll on down a little bit more, we kind of laid this out in terms of that color-coded map. So blue, there's minimal community spread, perhaps, and these are just ideas, the bar counter could be used for service. Patrons or parties would still have to be 6 feet apart and no more than 2 per party. It's kind of hard if you're sitting at a bar, if you've got 4 people, you get hunkered around. So that's where we came up with the two people in a party, and then they would each party again would have to be 6 feet apart. So depending on the size of your bar, you might be able to seat 3 people, or you might be able to seat 10 people, depending on how big your bar was. If we were in yellow, moderate community spread, then the bar top service could be allowed, provided that they have a full service menu, that would have to stop at 9 o'clock or pick a time. And then somebody did bring this up that I thought was good. Patrons may finish their meal, or you set a time limit so that if somebody comes up and starts their meal, they would have time to finish that. Again, a protective barrier separates patrons and staff, and that bar top service doesn't interfere with that drink service line that we talked about. And then if they're in orange, there's no seating at the bar top. they could still use the service lines. And then do you want to consider an early closing time? We just tried to outline that out using that color-coded ideas.
And I'm just scanning this order. Obviously, I'm not reading the whole thing right now, but I don't see anything that is specific to bar top seating.
And then if we're in red, I think that, we sort of have to determine what the best thing is, but carry out food is always going to be a better option. But if we're in red, it could be that we don't want to close places. So we want to try to avoid that at all costs. So hopefully we won't get to red, but that's why we left it to be determined by the situation.
And the governor's order does say red, carry out and delivery would be encouraged, but it doesn't say that they would close those facilities. They would recommend the facility close on their own, but they're not going to be the ones to do it.
I think if we're in red, a lot of people just stay home spontaneously anyway, so within luck.
That would be the hope.
Yeah. So it wouldn't behoove the restaurants to do anything other than carry out or delivery at that point.
Mm-hmm.
If they don't have many customers.
So because we do have that area, we are going to clarify that no dancing, no up and moving portion in there for sure, because I think that is going to be key at this point, because I have some of the complaints that we've gotten have been surrounded by that. And even if those folks are doing it safely, they shouldn't be doing it at all.
And that's by the executive order from the governor, even that's not
correct.
Yeah. I think that's a helpful clarification for us. And the fact that it's coming from the state is actually really helpful. Now, I know I see some, we've got some attendees from the public, so it may be good to hear from them. And again, to the extent that it's in the governor's order, our hands are tied. So we'll just be compliant with that.
Okay, where are we now? Are you wanting a vote today, or are we gonna just revise everything and bring it back and let people go through it, or go ahead and send it out?
What I would think is that, and let me sort of recap where I think we're at, and you can tell me if I'm wrong. I think that we will, based on guidance that I think you guys are giving us today, and I think you can vote on, if this sort of summary is correct, you can show your consensus that this is what you want to have happen. The next week, or tonight, we might start and get it finalized early next week, say by end of day Monday. We need to give businesses some time to respond, but that we will create a health regulations that will follow a color scheme similar to the state of Indiana. It will delegate authority to Dr. Sharp and to Penny to adjust as needed. It will definitely be reviewed on a weekly basis. It will change to say that indoor aerobic activity where a mask is not consistent, with that activity, that there's an exception, but that doesn't obviously include darts and pool. It will suggest to restaurants that if they have a small waiting room, that they do reservations and have patrons wait in their car and call them when their table is available. We will have it say that when it's in yellow, Staff members will have to serve any buffet food, cafeteria style. Orange and red, no buffets. There will be the provisions that we talked about in this draft order and reviewed with you. If you guys are okay with those, we will implement those. We will make sure that people know that there's not dancing or standing up. You know, we'll be consistent with the state order in that regard.
That is
Also,
unless they're doing that over the top bar ordering. So they're able to still stand in line to do that. Okay.
yes, that's right.
I don't know how we clarify between the two, but.
You know, I think that, I mean, you know, you're either, you know, in that line, getting that bar service or you're not. And, and so also, you know, that when there is bar top service, there's a line, and we'll have the language that we've talked about here tonight in there about, you know, that line, and it can't be all over the bar, it just has to be in a single place. So I think that with those pieces that we've talked about, we will work on that language and get that order ready, or that regulation ready. We can send around to you guys as well, but plan will be to implement that. Penny, do you think end of business day on Monday, or do you think, say, Tuesday at noon? What do you think is more reasonable?
I think probably, honestly, Tuesday at noon.
Okay.
You also mentioned something about making it more clear that unless you're eating or drinking, your mask should be on.
That's exactly right. Yep. Wear your mask. Yes, and we'll add that language. Thank you, Carol, about that. That the intent is to keep staff safe. And so when you're not eating or drinking, you should be sitting at your table with your mask on. And that definitely includes when you're ordering. Yep.
So do you need a motion now?
Do you want to take public comment from first?
Yeah, I think it would be good to take public comment and hear from them, and then
I'd like to hear how people feel about it before we look at it. So if there's any public comment before that to come before the board, raise your hand and let our tech person know. Is there anybody out there, Michelle?
We have two hands raised. First one is Michael Black.
Michael, okay. Go ahead, Mr. Black.
Okay, can you hear me?
We can.
Okay. The first, I have two questions. The first one is regarding the self-service stations as in a buffet. Will this also include the fountains at fast food restaurants or convenience stores, so forth? Where the regulations for the buffet also apply to those self-serve instances?
I think in the past that with the state, they did not include those self-service beverage. It was the same for gas stations, and Penny, correct me if I'm wrong, but I'm pretty sure that that was the clarification we got from the director of the food division at the state.
Right. Yeah. At one point you had to hand the cups and things, and then they took that piece away. I think that the idea with the buffets is really people standing up there and touching all the same utensils as they go through the line.
So for now, it's considered safe to have a self-serve beverage station, and we are not required to hand the cups to the patrons. They can get them out of the dispensers.
I would say we're not, as long as you're not allowing refills, that would be
right. I've seen that. I've also seen that where they can't get refills. My second question is regarding, you were talking about waiting areas inside of restaurants or establishments where there is no room to socially distance. Are you going to regulate the line outside of the establishment also? So are the people that are queued outside the business, are they to remain 6 feet apart? Which, I mean, that is downtown. I know at our corner, you can look in any direction and see masses of people outside of the establishments waiting to get in, not socially distanced on any weekend night. So is this something that we're trying? I know at one point we were trying to regulate that. So is that something we're going to have Aaron and his group look at, or are they already doing that?
So certainly people are supposed to, when they're in public, should be distancing themselves except for the party that they're with. So that remains. I think we recognize that that is problematic and difficult for even a business owner to try to monitor. We've tried some different things to work with people on that. So I think it has to be a combined effort of making sure that patrons know what's expected of them. And certainly as we see people, we can make that known as well. But that is a challenge. I'm not sure that I have the best answer for that. Because it does leave the businesses purview at some point once that line gets so long.
Some businesses, as it gets cold, and we talked about the lack of parking or whatever, are going to have propane heaters outside for people that are waiting in line. And those will attract a crowd. Now, I can see being outside, if everyone is masked, how that might be workable. But if they're not masked, I don't see how that could be safe. Crowded around a propane heater.
Okay.
So
good to know.
That's my recommendation. All right. Thank you.
Who was that? Mike Blackman. What does he do?
Our next person, Michelle.
All right, next up is Peter Iverson.
Hi, Peter.
Hi, everybody. Can you hear me all right?
We can.
All right. I'm Peter Iverson. I'm with the Monroe County Council. And first of all, I just wanted to thank you all for what you're doing. This is your expertise, and the time you're putting into this is so important. So thank you so much. I wanted to take some time and let you know that I have been hearing from my constituents. And you're hitting everything that they're asking for. Number one is they want access to testing. That just so many people are so concerned about whether or not they have COVID, whether or not the person they were just with had COVID. And so I'm really encouraged by the conversation that you had today about testing. That's what I'm hearing from constituents. The second thing I'm hearing from constituents is they want these regulations to keep all of us safe. I know I keep hearing about people who have relatives in facilities, older adults in facilities here in town. They're very concerned about them, and also, of course, the children in schools. So thank you very much for hitting on those notes as well, because I think that's something that I keep hearing about. The last thing I wanted to say is that I'm here listening to you and participating as I can because the County Council is supportive of your efforts. And I've been in touch, of course, with Penny and encouraged her to contact us in case there's anything that we can do to further your efforts. So I'm here in support of you and just wanted to say thank you.
Thank you so much. We appreciate that. Anybody else out there, Michelle?
There are no other hands raised.
Okay, board members, anything else you want to add to our discussion before we look for a vote? Does anybody want to make a motion?
I think Penny's speaking, but she's muted.
I'm sorry, Penny.
I was. Just shut me up, right?
It's Friday.
I know. Aaron made asked a good question, and that is for the bars that have places that have multiple bars. Can they have multiple lines, or should they have one designated line? As long as they meet all the requirements for that line, multiple lines would be acceptable, right? Okay.
Yeah. As long as they have the space to do it, yeah.
Okay.
I wanted to ask a quick question. Hey, Aaron, when you get those questions from these food service establishments, can you flag those reports for us so we can check out those questions and respond to them? I was looking at some of those reports today, and there were a couple questions that I wanted to be able to respond to, and I want to make sure I do that before they have more questions piled on top of those. So if you could flag those for me or for Penny, so we have those at the top of that list, we'd appreciate it.
Yeah, no, absolutely. We can flag those, and we've got some questions too. So maybe if we could carve out 15, 20 minutes every Monday or so, or Tuesday, to sit and talk to you and Penny and kind of ask the questions that we've been asked and the questions that we have moving forward with this. Just because I know not all establishments are alike. So there were some questions in reference to seating in some of them, but if we could carve out a little time on Mondays, that would be great. And that would get our questions answered and it'd give us an opportunity to give you the questions that we've been asked. Because we want to, I mean, the big thing is we want to be able to take answers back to these bar owners and bar managers when we see them and make sure we're giving them the right information.
We can certainly make that happen. I think it's great. It will help us too as we're thinking about and looking at what's going on. So.
Perfect.
Good.
I know Penny, you're off this Monday. Maybe we can do it Tuesday this week, Aaron.
Yeah, that'd be fine. Whatever works best for you guys. If you just send me an email and we can schedule it whenever works best for you guys.
Board members? Discussion, motion?
I move that we make the changes to this regulation as Margie outlined a few moments ago.
I'll second.
We have a motion and a second. Okay, all in favor? Cranner,
Aye.
Edgeman,
Yes.
Norrell,
Yes.
Pritchard,
Aye.
Talukian,
Yes.
Wren,
Yes.
and I also vote yes. So I think that's everything we needed to do today. Is there anything else anybody has?
Do we have an effective date or just we will determine that once we get this finished, or is the effective date Tuesday,
Tuesday at noon.
Okay.
I think, is that what you guys wanted to do, Tuesday at noon?
Okay.
Yeah.
Now, do you guys want to set another meeting date before we end?
I think it's always good to get something on the calendar.
I don't have it. Yes, I do. I can pull up a calendar here.
How soon do you think we should meet again, Margie? Or Penny? Or anybody?
Well, let's look. We've got the holidays to think about. Today's the 13th. If you could schedule a meeting for the 20th, that might be too soon. Maybe the first week of December. I don't know, Penny, what are you thinking?
Penny, you're muted.
Penny, you're muted again.
Sorry, I think the first week in December would be good, I think, on my end.
And if you find that something urgent comes up, we can always try to do one in between. But what days work for you guys?
Did I hear Dr. Sharp in the background say that wouldn't work?
Oh, he's taking a call.
A call?
I can't take the 1st of December. I'm ready. The 2nd, 3rd, and 4th are okay.
And I won't be here for the 4th, but
I can do anything that week.
3rd is okay.
What time on the 3rd works?
That's a Thursday. Shall we try our 5:30 again?
Would you rather do it? We're doing this earlier in the day, which doesn't bother me. If
I like earlier in the day.
except I have a hearing that Thursday afternoon, so I wouldn't be able to do it till probably 4 or later.
I'm for earlier in the day too.
I could. How about Wednesday?
Does Wednesday work for everybody?
I'm okay Wednesday.
December 2nd, right?
I have a Human Rights Commission meeting at 5 o'clock on the 2nd, but I could do a time before that or later.
You can do can we do a 3 like we did?
3. I like the 3 time. It works out well.
3 is good.
3 on the 2nd. Is that what you said?
Does that work for you, Bob? The 2nd?
Yes.
Okay. Okay, December the 2nd at 3 o'clock.
Okay.
Okay.
All right, we have.
Thank you, guys.
Okay,
Thank you so much, and we look forward to getting our draft copy or final copy.
Yeah.
Okay.
And you'll have a wonderful Thanksgiving.
Thank
All
you.
by yourself.
Goodness. Oh my goodness.
Zoom with your family.
Can I just add one thing here before we adjourn, please? If you're associated with a university as an employee or a student, the university is doing free exit testing this coming up week. And so I know there's a lot of people in this community that are associated, and I would encourage you, or if you have loved ones that are affiliated with the university, to have them or you tested before any gathering, right? So I just wanted to make sure and get that out there and highlight that. I looked at their schedule, and they've got open slots Monday, Tuesday, and Wednesday. I think they're all filled up for Thursday and Friday.
Great, Mark. Thank you. Any other board member comments?
I want to thank Penny for doing all the work that she does, and Tom. This is pretty deep stuff, but you kind of keeping up with it, and I appreciate that.
Well, let me say that I really appreciate and the department appreciates the backup.
Yes.
And the interest and the time. It doesn't go unnoticed.
Right. And I will tell you, Nicole's on here, and she deals with not just their normal routine things, but dealing with all the restaurants and these regulations, and she's doing a great job keeping everybody up to date. So
we appreciate you, Nicole.
Thank you so much.
And I sure want to wish everybody a happy Thanksgiving.
Great. Thanks, everybody.
Thank you.
Bye.
Bye-bye.
Thanks.